Okay, a really quick tutorial just to explain the difference between disinfectants, antiseptics, and antibiotics. So disinfectants are antimicrobial substances that are applied to non-living objects, and that's probably the key bit here. Disinfectants are used on non-living objects. So this is things like probably the strongest disinfectant are things like bleach. Chlorine bleach is often used to kill any bacteria in living things. Things like a lot of household cleaners are probably, especially some of the stronger ones would be considered disinfectants too. So antimicrobial, just to clarify what that means, really antimicrobial just means any substance that either kills or inhibits the growth of bacteria, fungi, or viruses. So that means essentially they're either for bacteria, for instance, they're either bacteriostatic, they stop or slow the growth, or they're bactericidal, they actually kill them. So either or. So preventing the growth or killing the microorganisms that cause disease. So disinfectants are antimicrobial substances that are applied to non-living objects. Antiseptics are antimicrobial substances that are applied to living tissue or to the skin. So essentially these are things like you may, Savlon as a brand of, it's an antiseptic cream. So any kind of cream that you put on an infected wound or a cut to help prevent it getting infected is an example of an antiseptic. So an antiseptic is kind of any substance that's put on living tissue or skin to kill or prevent the growth of bacteria. And finally, an antibiotic is an antimicrobial substance or medicine that is introduced into the body. So medicine here really just meaning a substance that's introduced or put into the body. So that can be taken orally, so in the form of, say, a pill which is swallowed, or they can be introduced, as an injection or into the bloodstream. But basically an antibiotic is any antimicrobial substance that is introduced into the body. So you actually take it as inside the body. So that's really the different levels. Disinfectants are on non-living objects, antiseptics are used on living tissues or skins, and antibiotics are introduced into the body. So if we compare the three, essentially as we go down here, they become more selective. So what do we mean by selective? Well, essentially bleach is very effective at killing bacteria, but it also, if you drank bleach, unfortunately, you could do yourself a lot of harm or even kill yourself. So it's not very selective, and that's why we can't use it as an antibiotic. So what we mean by more selective is that the things we tend to take as antibiotics kill bacteria and fungi and viruses, or those bacteria, fungi, viruses that cause disease, without killing or damaging the human cells. So it gets more specific to trying to kill what it actually should be killing. And so on the other side, and this is really generally speaking, there are exceptions. There are maybe some antiseptics that are stronger than some disinfectants, and I guess it also depends on the quantity and concentration. But as a general rule, disinfectants tend to be much stronger because they're less selective. It's more, this is the nuke of the antimicrobial. It kills everything. Whereas the antibiotics are more like the sniper or something. It's very specific to its target, and the antiseptics, maybe that's the grenade or something in between. So as we go up, disinfectants tend to be much stronger, much more effective at actually killing the bacteria. So for instance, pretty much the most effective thing at killing microorganisms is bleach. However, because it's less selective, because it also damages other cells, it's not something that we'd really want to use as an antiseptic or an antibiotic. So they tend to be slightly stronger going up this way, and they definitely become more selective as we go down here. So antibiotics being much more selective. So I guess there's a bit of a trade-off there. More selective means we can take it internally because it won't do damage to us. Whereas but the trade-off is maybe it's not quite as effective at killing them. But there are antibiotics that are still effective enough, and if you take a high enough dose, they do the trick. And antibiotics have been a major discovery that have improved healthcare in the Western world over history, and saved many lives. In the past, basically, if you got a bacterial infection, if you got sick, they could put you in a bed and give you lots of fluids and try to make you comfortable. But pretty much either your immune system would fight it or it would kill you. And, those were the two options. Whereas nowadays, a lot of people, have, get infections or get sick from things that potentially could be life-threatening if left untreated. But a course of antibiotics and it's done and dusted and we can go back to normal life. One issue that we have, though, here with antibiotics is their overuse. We are seeing strains of bacteria develop antibiotic resistance. So if you imagine if you had some bacteria here, and essentially, so someone's infected with these bacteria, just scribbling a few circles, and maybe some of them, maybe one or two, I hope you can see the yellow there, maybe some of them are slightly more resistant to the antibiotic. And so what might happen is someone might take the antibiotic until they feel better. And obviously the last of the bacteria to die off, the last ones to die are the most resistant ones. So all the red ones get killed off first, and there may only be a few left. And because there's only a few left, the person might already feel much better. In fact, they may feel like they've completely recovered. So they stop taking the antibiotic because they feel better. And then suddenly these resistant bacteria can then multiply, and so suddenly they're infected with a large number of resistant bacteria. And as bacteria reproduce, they're a bit sloppy with copying their DNA, so they often make some mistakes. And so that means just by pure chance, some of these will be less resistant, like the original red ones, but some of them, by pure chance, will be even more resistant. So maybe the green one here. And so if this goes through cycles, so then someone else catches this and then they don't complete their antibiotics, so these green ones build up. If you keep going through cycles with us, we keep selecting for the most resistant bacteria and killing off the weakest ones. Eventually we end up with some pretty resistant bacteria. And so this is kind of why it's really important. You'll notice if you ever get antibiotics from the doctor, it will say, it might say, take 1 tablet 3 times a day until finished. So until you finish the bottle. And that's basically, the reason for that is even if you feel better, there could be a few bacteria still hiding out in your body somewhere, and we want to kill those off before you stop taking antibiotics so that we don't get these resistant strains building up. And it's really quite scary, actually. It doesn't sort of sound like such a big deal, but the average dose of penicillin needed to treat various infections these days has really increased tenfold since they first started using penicillin. So we're using 10 times as much of the drug as we used to treat some of the conditions. And there are some strains that emerge every so often in hospitals that pop up that are completely resistant to some of the antibiotics that are used. And that's a bit scary because then that person essentially is left to chance whether they recover on their own or whether they don't. Or we use other antibiotics, but eventually, there's only a certain number of them, and yes, maybe, scientists are working on trying to discover new antibiotics, but I guess some of the newer or some of the antibiotics that these things aren't resistant to, sometimes they have some pretty nasty side effects too. So, the ones we tend to use the most are the ones that have the least side effects, and unfortunately they're becoming less and less effective. So antibiotics work in lots of different ways. They kill bacteria by either breaking down either breaking down the cell wall or the cell membrane. Sometimes they can interfere with the DNA or the use of DNA, so how the DNA is expressed inside the bacteria. It can sometimes interfere with some of the biochemistry, some of the processes or reactions that are essential inside the bacteria, and so certain things build up, or the bacteria doesn't get enough of something because the antibiotics interfered with that. So there's lots of different ways antibiotics can work. But one really important note for those of you studying this is antibiotics, and I guess maybe that's my definition here. It says antimicrobial, but it's really antibiotics only are a term that generally is reserved for bacteria. So antibiotics really only kill bacteria. It is sometimes used for fungi. Sometimes people will talk possibly for fungi, but really antibiotics are substances that kill bacteria. So antibiotics do not. Now, antiseptics and disinfectants might, but antibiotics do not kill viruses. And because of the issue of the issue of antibiotic resistance, and that's partly due to the overuse of antibiotics. If you go to the doctor and you've just got a bit of this, if you've got the sniffles, chances are it's probably caused by a virus. So if you've just got a bit of a cold, there's a good chance that might be caused by a virus, probably a rhinovirus or something like that. And so doctors will be very hesitant to prescribe antibiotics if it's caused by a virus, because the antibiotics will have no effect on the virus, so they're not going to help you. But if you have some bacteria in you, again, you're helping. It could potentially help bacteria build up that resistance to antibiotics. Even if they're non-pathogenic, if they're not disease-causing bacteria, just other bacteria in your body, they may then actually pass on that antibiotic resistance to other bacteria. So it's basically doctors don't want to prescribe, or often will be hesitant to prescribe antibiotics unless they see evidence that it is actually a bacterial infection. So if you've got a cold, if you've got a cold, one way, often viral infections, you'll get a really runny nose and things like that, but the fluid will be fairly clear. Whereas bacterial infections, often you get that lovely green kind of, that greeny yellow kind of gunk, and often then, especially if your lungs get infected, you'll cough up these sort of chunky, greeny, mucousy stuff. That's a sign that it may be bacterial. And sometimes, unfortunately, it can actually start off as a viral infection, and because there's so much mucus and because it's sort of running down your throat, bacteria can get trapped in there and get down into the lungs, and it can turn into a bacterial infection. So once you see that sort of bright yellowy, greeny kind of mucousy, and especially if you're coughing it up, then there's a good chance that maybe bacteria, and a doctor's much more likely to prescribe you some antibiotics to clear that up. Key ideas there. Disinfectants are on non-living objects. Antiseptics are used on living tissues or skins. Antibiotics are introduced into the body. They only really kill bacteria, or at least they definitely do not kill viruses. So there are some drugs that are called antivirals that can be used to help kill viruses, but they're not very commonly used or are still being developed. So antibiotics kill bacteria, aren't effective against viruses. Cool. I hope you found that helpful.